All right, welcome back. This is Nurse Franny, and we're going to go over some minor topics or maybe some ideas for flashcards that you might need if you have a minor quiz for including bone tissue and joints. So for this video, we're just going to go over some flashcard ideas for bone tissue. The first one, obviously, as the bone says, you want to know what a bone tissue is. And so that's our first card. For bone tissue, you want to understand that it is a connective tissue with a hardened matrix. Okay, so you want to know that it does have a hardened matrix by calcium, phosphate, and other minerals. All right, so you have calcium, phosphate, and other minerals. Okay, the second one I would say is mineralization. Now, mineralization, that is the calcification or the hardening process. Okay, so that's also called calcification or hardening. The next one I would learn tendons. What are tendons? And we know that a tendon connects muscle to bone. Okay, so muscle to bone is your tendons. You want to know ligaments. Ligaments, they actually connect bone to bone. Bone to bone. The way that I remember it's be right back, but BLB for ligaments. Functions of the skeleton. So whenever you learn a system, you want to know the functions of the system. Functions of skeletal system. And for this one, you absolutely want to remember at least 6. So we have support, we have protection, and this is all behind your flashcard. I know it might be a lot for some of them. We have electrolyte balance and acid-base balance and blood formation. So I'm just going to put elec balance for electrolyte balance. We have our acid-base balance, and we have our blood formation that occurs in the bone marrow. Next, we have general features of the bone or bone shape. So you want to know what bones look like, right? General features, put in parentheses, shape. So you want to know for a quiz that you have flat bones. Okay, but what do flat bones do? They actually protect soft organs. So I'm going to put protect soft organs. Sorry. Then we have our long bones that I'm going to draw in a second. We have our short bones. Now the short bones are actually wider. Actually, no, the short bones are equal in length and width. Okay, equal in length and width. And then we have our irregular bones. These irregular bones actually just don't fit in any of these prior classifications. You need to know what a diaphysis is, and also the epiphyses and epiphysis. So let me just put this right here. I'm gonna draw these out. This is actually just like the cylinder portion, or like the neck, or the more long part of the bone, where the epiphysis is like the heads, right? Like the head of the bone. That's that little, both ends. You'll know what I'm talking about when you see it. Medullary cavity. You want to know what that is? That's another idea for a flashcard, is to space in the diaphyses with bone marrow. So, just look inside. It's literally inside the bone. And it's the space. And that's where you find the bone marrow. Compact bone. You need to know compact bone. Compact bone is actually just the outer shell. All right, outer shell. We're always talking about bones here. Now, spongy bone, just gonna put a B here. That's just the inside, all right? Now, spongy bone is also called cancellous. So I'm just gonna put that here. Because we know spongy bone, it's literally just the inside. Cancellous bone. Articular cartilage. So this is a good one. Articular cartilage is a layer, and I'm just going to put it all uppercase, layer of the hyoid bone, where two bones meet. Okay, two bones. I'm just going to put B for bones meet. Epiphyseal plate, or the growth plate, is actually really important. So the epiphyseal plate, again, if I'm mispronouncing any of these things, just please let me know, and I'll be more than happy to, just leave it on a comment. So this is also known as a growth plate. This guy, it separates the marrow between the diaphyses and the epiphysis. All right. So let's see right here, according to the textbook, it separates the marrow it separates the marrow space between the diaphyses and the epiphyses. I'm trying to look for a really good picture that I might be able to show you. Let me see if I can draw it. So, let's see right here. Okay. So if this, hold on. Great. So if this is our bone, that's horrible. Right here, you have a growth plate or an epiphyseal plate. And this is a line, okay? It actually has articular cartilage. It's a layer. Actually, no, articular cartilage is right here, so never mind that. But here, you have some hyaline cartilage too, because it separates. This used to be two bones before the growth plate actually diminished, because the older you get, and this actually stops in adolescence, so the older you get, the longer your bones get, right? So your bones grow in length when you get older. But this plate that I'm pointing at, right here, gets smaller and smaller. And then if it's finally gone. So during an exam, you might have a question that says, hey, what type of joints do you have more of as you get older, right? And your answer is actually going to be a bony joint, and we're going to talk about that in another video, because you first had this growth plate here, but now these two bones actually meet, and you now just have one. Now remember that inside here you have marrow, and inside here you have bone marrow. And this plate actually separates this marrow that I'm going to point at with green is this one. And the one up here is red bone marrow. That's another video. The one down here is yellow bone marrow. It actually has more adipocytes. And it no longer produces blood cells. The one in the red marrow that you could actually find in the epiphyses, that still actually produces blood cells. But that's that. So let me just X out of here and go down. Hold on. Give me a second. So a little check mark. All right. We are now going to start talking about the different cells. So I think that we might actually save that for a different video. So before I end the video, let's just quickly go over some little, so what we, pretty much the intro. Bone tissue, it's the hardened matrix by calcium, phosphate, and other minerals. Mineralization is the calcification and hardening of the bone. Tendons, they connect muscle to bone. Ligaments connects bone to bone. The functions of the skeletal system: support, protection, movement, electrolyte balance, acid-base balance, and blood formation. General features of the bone or shapes: you got flat bones that protect soft organs, long bones, short bones, irregular bones. The irregular bones are just bones that don't really fit in any of those categories. Epiphyses is the head, right? Medullary cavity, or it's inside of the bone. That space, right? That cavity. Cavity is, cavern, cave, space, where your bone marrow resides. Compact bone is just the outer shell. You remember the periosteum, right? It's that pain-sensitive membrane. Not membrane, but part of the bone. Spongy bone or cancellous bone. It's pretty much the what lines the inside of the bone. Very porous. Not as hard as compact bone. Not as dense. We have articular cartilage, which is a layer of hyaline bone where two bones meet. We have epiphyseal plate, which is a growth plate, and it separates. In most cases, you're going to see that epiphyseal plate. Whenever you see an X-ray, there are going to be lines, like the one that I have here. I'm just wiggling here where the bone is. That line, that horizontal line that you clearly see on my really bad drawing, that is your growth plate, and it separates the epiphyses from the diaphyses, and the marrow from the epiphyses, the red marrow, away from the yellow bone marrow. So that's that for now. I'm going to go ahead and record a different video so that you just don't have a 45-minute chunk of flashcards. We'll just do it 10 by 10, 10 minute by 10 minute if we can. Thanks again.